Still good morning. I'm Rebecca Kirch with the National Patient Advocate Foundation, and I really do health policy for a living, and there's some policy levers that I always draw on, sort of that tried and true toolkit, um, emphasizing specific research needs where there are gaps, and that's something that the National Academies is so good at focusing on, is where are the gaps so that we can fill them. Education and training for professionals, but also advocacy training for patients and caregivers. And then public awareness, performance standards, accreditation standards, that sort of thing. So those are sort of the levers that I'm always thinking about, which ones can I push and pull where to advance what we need to do under this umbrella that I'm thinking quite a bit about in terms of the policy stakes, which are high, is using the momentum of value-based care. That has real momentum, as does the oncology care model that Ron mentioned. To advance a person-centered system of policies and practices that really improve the lived experience for adults and children that are coping with their cancer or its aftermath throughout survivorship. And I want to emphasize, too, the importance of really specifically calling out policies that acknowledge and support caregiving, which is an increasingly important additional cost-sharing maneuver that the health system is relying on now to think about how do we use the value of caregivers to our advantage across the entire continuum of care for all people with serious illness, but certainly in the context of cancer. So if you think about those different levers, there are three different solutions that my organization and many others are working to advance in this spirit of value-based care and person-centered care. First is assessing people's needs. And I'm going to channel Meg Gaines a little bit here because we can presumptively assume what people need to be screened for. But if we were to ask them what's important to them and what they value, we'll get a lot more useful information and expertise from the people who are experiencing their illness about what's important to them in terms of their lived experience. So assessing that and addressing the needs, and I know we heard quite a bit about psychosocial support, rehabilitation care, palliative care as essential aspects of quality cancer care, but also survivorship care. So assessing people for their needs for these supportive services alongside disease-directed treatment, and then carrying through the continuum of care to make sure that that lived experience is supported for these adults and children, and the caregivers who are often caring for them. The second policy area is using meaningful patient-reported outcomes, survivor-reported outcomes, and caregiver-reported outcomes in this constellation of different quality measures and value assessments that are part of value-based care, and indeed even the oncology care model. We need to really get input, not feedback, but input early on from patients and survivors about what matters to them in terms of important outcomes, reflecting improved lived experience, not just disease-free progression or the other standard outcomes-related measures, so that we can support what people value in terms of all the different quality and value assessments, accreditation standards, performance standards. And then the third piece or arm of policy activity really is sort of, I would say, the fundamental foundation, and we've talked about it in a few different ways through this workshop, that clinical team, patient, and family relationship. Really, the foundation of it is skilled communication about person-centered care and people's needs, using the expertise of patients and their caregivers to talk about what's important to them, together with the clinical expertise about valuable survivorship care and disease-directed care. But we're assuming that these clinical skills that clinicians need to focus on the person have been trained, and they haven't in many cases. And so thinking about this as a learned skill that needs accreditation standards and education and training across the board to be reflected in quality measures is an area I think that has really ripe opportunity for policy solutions. And I know, having read most of the Institute of Medicine and National Academies books that are out on the table and on our computers, the IOM in three consensus reports now has recommended the importance of, for oncology training across the board, clinical communication skills. And I think that's something that has real legs in the spirit of value-based care to take us to the next level.